The third reason that chronic low back pain is on the rise is because it's overtreated and over-commercialized. Now, I've already done videos on the first two reasons, being that it's overdiagnosed and it's over-imaged. I'm going to show you why it's overtreated and the harms that can come from that. Here's an example of the scientific literature showing how many different ways back pain can be treated. You can see how it's ultra confusing. And this isn't even a complete list. What this doesn't show is that there are also 23 different types of clinical professionals that treat back pain, each of whom feel that their way is the absolute best way. This was shown in a scientific article years ago, and things are even worse today. You can see what the authors said during this article. They indicated that science is playing less of a role in the back pain treatments that are being offered, and it's more about marketing, hype, and commercialization. Here's some of the additional literature I'll be using to illustrate how back pain is overtreated and the dangers that can occur. I'll go into more detail when I release the full video. If you or someone you know is dealing with back pain, it's something you will definitely want to check out. This is a 2022 article published in the journal Lancet. You can see the title, The Need to Reduce Low Value Care, and there's a lot of it. Here's an article also 2022 from the American Association of Family Physicians, pretty much echoing what was said in Lancet. These two books are books that I'd recommend you obtain. They talk about the dark side of spine care and how many things are promoted without scientific evidence and also purely for the motive of profit. And then finally, this recent article from 2025 published in the British Medical Journal looked at a bunch of different treatments for low back pain. I believe over 50 different treatments, and found that only 1 in 10 of those treatments had any evidence of effectiveness, and that one treatment that did have evidence had only minimal evidence of effectiveness as compared to a placebo. This video that I'm going to release shortly is going to open your eyes to the overtreatment and over-commercialization of back pain and show you things that you would have never considered. Again, if you're dealing with back pain, watch it. If you know someone who's dealing with back pain, make sure they see it.